Hi, I'm Dr. Kaila Girvan. I'm a surgical dentist and accredited provider of sedation in Glasgow, Scotland. In this video, as a follow-on from the previous, I'd like to talk you through the sedation journey, breaking down each step from the very first appointment right through to recovery and aftercare. The sedation process always begins with a pre-assessment appointment. This visit's very important for a number of reasons. The dentist will assess you medically to ensure you're suitable for sedation, but it provides the perfect opportunity for us to give you all of the necessary information and for you to ask any questions you might have. The dentist will complete the necessary paperwork and take some measurements from you. Height, weight, blood pressure, heart rate, and oxygen saturation, which is simply a measure of the level of oxygen in your blood. All done easily and painlessly, although some of the equipment for this might be new to you. You then have time to process all of the information, call the clinic with any further questions, or you may in fact decide that sedation isn't for you. You will always be given written information to take away and read at home. You can't have IV sedation if you're pregnant, and if you're a nursing mother, you can't breastfeed for 24 hours after your procedure. Now, there are a number of important instructions to follow on the day of your procedure, all of which you'll have been told about beforehand and are included in the written paperwork given to you at your first appointment. First and foremost, you absolutely must have an escort with you on the day of your procedure. This is a person over the age of 18 who can look after you and assist with getting you home safely. This person must attend with you at the time of your appointment, and we ask that they remain in the building for the duration of your procedure, although they typically won't be allowed in the room during your treatment. With regards to fasting before your procedure, every clinic will have their own specific advice on this. In my practice, patients are advised to eat a light meal 2 hours before their appointment, after which they can have small sips of water if thirsty. You should wear loose, comfortable clothing and flat, stable shoes. For example, no high heels or flip-flops, as you might trip. You should have clean, bare nails, as nail polish or false nails will interfere with our monitoring equipment. You should ensure that you take all of your routine medication as normal unless you've been specifically told otherwise by the dentist. No alcohol for 24 hours before your appointment, as this can adversely interact with the sedation drug. Finally, but importantly, you must arrange to go home by private transport with your escort, which means by taxi or car. For obvious reasons, we don't want you walking home or taking public transport. On the day of your procedure, the dentist will confirm your treatment plan with you, ensure you've got an escort with you, and check you followed all the pre-op instructions. You'll typically be asked when you last ate and drank, what exactly you had, if you're taking any new medication, and how you'll be getting home. We will also ask for your escort's details, often their name and phone number. The same equipment used at the pre-assessment visit will be used to monitor you throughout the procedure, and this is simply a cuff or armband placed on the upper arm and a small plastic clip which attaches on the end of your finger. Once these checks are complete, the dentist will place the cannula or IV into a vein, which is often either in the back of the hand or the inner elbow. The cannula we tend to use in dental sedation is very small, and this often doesn't require any numbing cream. It's not dissimilar to, let's say, having a routine blood sample taken. However, for patients with fear or phobia of needles, we can of course adopt a couple of other methods to make this really easy for you. In my practice, we can also provide inhalation sedation, which is nitrous oxide or happy gas. We place a small mask on your nose first to relax you, in combination with some numbing cream on the arm, and this makes placement of the cannula super easy. Once the cannula is placed and secured, there's no needle in your arm, only a very small hollow tube, which allows us to administer the sedation drug. After a few minutes, the cannula will feel quite comfortable, and patients often forget that it's there. It will remain in position until you're ready to leave the practice. Once your treatment is complete, you'll either remain in that particular room to recover for a period of time, or you might be moved to a dedicated recovery room where a member of staff will monitor you. The length of this recovery period depends on how much of the sedation drug you've had and how long ago you were administered the last dose, but typically this is no more than an hour. Your escort may be allowed to sit with you in recovery, but this will depend on the clinic. By the end of this period, you'll feel a little bit more like yourself. However, the drug is still in your system, you're going to be unsteady on your feet and remain quite drowsy. The cannula is removed once you're fully recovered. Aftercare instructions will be given to your escort, as you're unlikely to remember this information by the next day, but these instructions will also be provided in written format. For the first 24 hours following your procedure, you must not drive, return to work, sign legal documents, look after children or dependents, operate machinery, or drink alcohol, and it's crucial you follow this advice. The drug remains in your system for about 12 hours. You'll be very drowsy for at least the first 8, which often means the rest of that day. We ask that your escort monitors you for this period. If your sedation appointment happens to be in the evening, it may be wise that someone monitors you overnight, and you may have to make arrangements for this if you live alone. Your escort will help you into a taxi or car, and their responsibility is to get you home safely, which will include assisting you into your house, especially if you're in a flat or need to climb any stairs. Sedation often allows us to carry out more treatment in a single visit, and for a lot of patients, they can have everything completed in 1 to 2 visits, but this depends on your specific treatment plan and how much dentistry is required.